So when we talk about long-term care facilities, we're talking about skilled nursing homes, assisted living facilities. And then when we talk about the smaller ones, adult foster care homes and homes for the aged and facilities like that. And so what we have been doing is trying to give them more support with regards to infection control in terms of identifying where their needs are, trying to find out what they need, what they know, what they don't know, and then trying to fill those gaps.
These are private homes, essentially, that have been licensed through the Department of Health to do care. And the acuity of the residents in those really varies. It can be similar to assisted living facility, or it can actually be, kind of close to what you would see in a skilled nursing facility. But they're very limited since they're private homes. We have almost 1,200 adult family homes in King County. So that's a much different undertaking, a much larger undertaking you can imagine. It also takes a lot more resources because it's more difficult to schedule at adult family homes. Their schedules are harder to accommodate because they don't have a lot of support staff. They also are very geographically spread out. We knew that there was a huge benefit for doing routine testing of staff in particular in skilled nursing facilities and assisted living facilities. We didn't know what the status was in adult family homes. So we had not heard about nearly as many outbreaks in adult family homes at that point. And so we wanted to do some proactive testing or screening testing in adult family homes and a subset of adult family homes kind of in the highest risk areas to see if we were finding cases and finding outbreaks that we didn't know about.
Some of these facilities are really small. Some have 4 residents, 6 residents, and then some have 13. Actually, the ones who are smaller, some of the larger state regulations don't exactly apply to them because they're small and they could almost be regarded as homes. And so because of that, their needs are different.
Our goal was to identify 60 adult family homes that would be willing to have this proactive testing done, point prevalence testing done. And we identified 59, and we focused on adult family homes that had residents that were a higher proportion Medicaid payers, also that were in South King County, and that had higher BIPOC populations in their residents and in their staff. We found one positive case, and that was out of 215 staff members tested.
In Ingham County, we had 116 facilities that we identified through LARA, which is our regulatory body. And so we reached out to every single one of them. Although not all of them wanted our help, overall, we were able to go in person to do assessments to about 40 facilities overall and give them the support that they need. In addition to that, we created a web page specifically for long-term care facilities that these small facilities would need. We put samples of forms that they need to fill out, checklists that they need if they have an outbreak, what they need in order to where they need to go, who to contact if they do have cases, listing things like that, providing materials for them to use, because all of that material is out there, but they're in different places. And even I struggle to find a lot of that material. So putting it in one place for them where it's streamlined specifically for them and updated.
We looked at the results of that and used it as an opportunity to improve our relationships with our adult family homes and also our adult family home professional organization is referred to as the Adult Family Home Council. So they were very involved with this project. Going into it is our collaboration with CoMagine Health, our quality improvement organization. We made sure and added adult family homes to the invite list for the project we did with them, which was and still is a weekly question and answer session with long-term care facilities. If you get people on the phone that either the long-term care facilities want to hear from or have a vested interest in hearing from, i.e. the regulatory agencies, And you get people that hopefully they trust, or people that you want them to start trusting, and you get them all in one place and provide a resource that they need, which is answering questions about something as confusing and as ever changing as COVID. You will get a great response.
So we're talking about infection control here, but I think that looking at all of our processes, including infection control at any level, addressing the inequities that we see in healthcare generally are a critical piece to infection control being effective, quite frankly.
So one big thing we relied on was getting our testing supplies from our state health department. So the Washington Department of Health provided us all the testing materials so that we could actually go and do the testing. So I would probably start there. Even if the state health department can't provide all of the support needed, they may be able to direct you to another county that might also be able to help provide support. And then also the professional organizations, getting buy-in from them is really important, because we did run into some challenges where there were adult family homes who weren't interested in having testing done for very good reason. We found only one case out of 59 homes. And so a lot of the homes were saying, we don't want you to come here because we're so well isolated that we feel like the risk of you coming in will be that brings COVID into our facility, which was not unwarranted, especially given the data that we ended up finding. Adult family home professional organization would be a big key as well. And then the quality improvement networks for your area often will also have great resources and contacts. And if you're going to work with adult family homes, you should be ready to have all of your materials in multiple languages and have translation services available.